Okay, this morning I want to show you a patient where we did a minimally invasive retrocalcaneal heel spur resection, and he's out now 8 months. So we want to show some people long-term too for this. We've got about 5 or 6 cases together now, and we'll continue to build that. Basically what we do an incision. If you look at the back of his heel now, we'll show you the pictures of his heel before the surgery. So there's no pain back here at all now. So basically what we do, we approach the haglins underneath by making an incision here and on the outside of the foot here. And under the C-arm, we resect the haglins. And then for his case, he had a bone spur right here. We went anterior to the bone spur and removed the bone spur. And we'll show you the x-rays on that and also the intraoperative C-arm pictures as well. So, but the main thing I want to look at is how quick this is compared to taking the tendon off, taking the spurs out, and reattaching tendon, which works really well. But it's just a big recovery for patients for detaching the tendon and putting the tendon back on. So let me ask you something. He's out in 8 months. Are you able to work now? You
Yes, sir.
When did you go back to work after the surgery? How long did you stay out?
I stayed out till April the 1st.
April 1st. So that would have been about 3 months or so?
Yes, sir.
So he stayed out of work for 3 months. So he did follow protocol properly and he wore a cam walker for most of that time, right?
Yeah.
And we wore a cast for what, 3 weeks first?
Yeah.
We wore a below knee cast for 3 weeks, followed by the cam walker for additional 3 to 4 weeks. So let me ask you this, Donnie. Before we did the surgery, how painful was your foot from 0 to 10?
10.
So 10 every day.
Every day.
10. Okay, now back at work and doing the things you normally do. What's your pain level every day now?
0.
0. So we went from a 10 to 0, and it's holding out for us too. This is 10 months later. We'll kind of look back at us in 12 months and continue following him to see how well he does with it. So anyway, we kind of wanted to show this to you and show you that you can perform not only Haglund's deformity with minimally invasive procedures, but you can also perform retrocalcaneal heel spur resection along with the Haglund's, where people that have that deformity now. Sometimes the deformity is so large you have to open it. If you have a really big spur in the Achilles, it's taking up most of the circumference of the heel spur, you're going to have to open that up and detach the tendon. But with a lot of patients, that spur is just inner tendinous, so you can go around that and take that off and not have to detach the tendon.